The dispensation is just that they have to consent to come to the centers every day.
So now when we actually look into it, then now the victims are like the most, age group wise, like 18 to 50 years as per study that, as per study that was done by AIMS, MSG, Ministry of Social Justice and Empowerment, which was published in 2019. In that report it says 18 to 50 years group are the victims. And even like leave aside substance abuse, that is alcohol or cannabis or any form of drugs, but now even opiate users itself, from that study it shows 6.5%, that will come to approximately around 130. That was some 3-4 years back. It was done in 2017, and then now like it's almost more than 7 years, and then there is an increase in the drug use. And even for that matter, like with 6.5 means 1.3 approximately, with the the population that we have, like 20 lakhs estimated, so it will come to around 1.3 lakhs. So that's a very huge problem that we are facing. That was some 7 years back, but now even with sex, as report from sex, like we are able to reach out to only 27,450 opiate users. That also only people who inject drugs. Then what about the people who are orally using? That's a big concern again. So now with the sharing of needles, now the current statistic of HIV till July is 9.24 when it comes to HIV. So HIV infection is 9.24. That means it's very huge. And just the day before, like the law enforcement also have destroyed some drugs, which amounted to 44.5 crores. Imagine, that's huge. 44.5 crore rupees worth drug was destroyed the day before yesterday. And till July to September, some 30.4 crores worth of drug was seized by Nagaland police. So from this we can know that like drug use has increased, and even and for that matter, those people who are already on OST is around 9,499. As Dr. Our previous speaker has mentioned, 9,499 people are on the OST, where 1,322 are under the NGO implemented OST programs, and government program 8,177. So looking into the into the numbers and the kind of services that we have, it's very limited. So talk about rehabilitation programs. We have very less rehabilitation programs. And then aside from that, then what about the other people? What about the rest? If we are able to accommodate, say, around 10% of the people who are using drugs in the rehab, then what about the 90%? That's a big concern. So now, when we seriously look into it, now even sex is only catering to people who inject drugs. Then what about the oral users, who can be a very potential, injecting drug users in the coming future also? And with the kind of drugs that is being used in the state now with sunflower, we come to know that there's a lot of injecting episodes that are also happening, and that's a concern. And we have been doing programs with the schools also, and we hear instances where even the school authorities, they tell us that like some of our students are already into sunflower. And these people who are already just recently started, like they are not accounted. They are not part of any programs. So we are not able to reach out to those people because, with the limited programs that we have, then what about the rest of the people who are still using and then like who are not part of any program, neither the rehab nor the OST? Now what do we do with those people? That's a very grievous situation we are in now. So now, like since we we have the privilege of having this consultation, and then now where the key stakeholders all have come together, and then let's think about what we should do collectively.
Now, I believe OST was something that had been introduced by the AIDS control program, purely on the focus of HIV prevention among injecting drug users. However, it brings a whole lot of additional value to not only in terms of HIV prevention, but it helps the drug users physically also, as well as in their productivity level also. For example, if we talk about the route of transmission of viral hepatitis, we can also say that it is more or less similar to that of HIV. But in doing an HIV control program, we are directly or indirectly controlling and preventing the spread of viral hepatitis B and C amongst the injecting drug users also. So these are behind the scene kind of an additional value that this OST bring upon. Now let me reflect back to the 2002-03 era, where I was also very new in my recovery, and I was working with Kripa Foundation at that point of time. And I believe that was during the stage of the National AIDS Control Program Phase 2. Now we're in the Phase 5. So 20 years approximately down the line, 2002-03, something like that. We newly recovering drug users, when we meet with our friends, we used to keep on discussing what if there was something that could possibly, and we have heard stories from Australia, stories from other countries that those governments used to provide a legal opioid. That was like a far dream today. If I lay it out today, it was like a far dream that how can any government provide a legal drug as a substitution therapy? Will that be a reality in our state? That was like a far dream when we were discussing all those with our friends. And we were longing for this. That time we don't call it as OST. We call it ST, substitution therapy. So ST do ahile bal hobo, or something like that is what we always long for, and we keep on discussing. Personally, on my side of the story, I got married. During those years, I shifted my house from where I was staying to a little upper setting, and then from that, I could see the location of our office. So on a holiday also, that time because we were like trying to balance the whole program, so whenever I'm not in the office, I used to look from the window of my house to the service center. It's a little far, but it's still visible. Human movements are still visible. I see that drug users used to be in queue, just as the way we were in queue for the coffee. Drug users used to be in queue to come to our service centers. So that speaks volumes about the receptiveness of the program. And it's a very good impression that they have created, because our office usually, the OST center, it usually opens at 10. Now drug users used to be waiting in our service center even around 9 a.m. also. Okay. And the turnout was massive, I would say. And that time, we initially started with 4 service centers. Kripa Foundation in Kohima, in Dimapur by Guardian Angel, and those are the names of the NGOs, 2 in Dimapur and 1 in Fasuro. We started with only 4 sites initially. It went on for around 2 years, those 4 sites. But the learning experience that we have had, the responses, it came up so well that initially we started with 100 drug users as our targeted clients only in terms of numbers. But more and more demands were coming, more and more people were turning out. So Tushi and all, that time they were working with us as the program supervisor, technical support people. So they keep coming around, and then we used to have a very good discussion about all this to say that we want to increase the target because this is the demand of the drug users. They were coming in. Now, on the larger perspective, how this has actually impacted their lives is something that I want to also express. I understand that Dr. Sankri also is going to, I believe, more or less talk about the myths and misconception, as well as even the philosophy of this buprenorphine program. However, on the personal experience, I would say that drug users being in our office, now it's not just them coming and taking their daily dose and going back. They used to have a good time and used to be very happy being with us in our service centers. Now this medicine intake is just a matter of 5 or at the most 10 minutes of sublingual intake of this OST program. But after that also, they are happy to be with us in our office. They used to play carom boards. Those days it was not the smartphone era. So Chinese checker, chess, carom boards were all the in thing. So it was like a crowded place all the time. Our office was so receptive by them, and they love coming to our office and being with us. Even after their daily dose is done also, that they used to love spending the time with us.
Just in short, I want to distinguish. Let's talk about a little bit of pharmacology regarding drug use. Almost all illicit opiate drugs, they have a feature wherein it lasts in your body only for 6 hours. That means if this particular person took the drug at 12 a.m., by 6 a.m., he will start craving and start having withdrawals. So withdrawals, body ache, excess of lacrimation, your nose will start leaking, your eyes will start tearing up, you'll experience goosebumps, and then including diarrhea. So no other drug can control that, by the way. So you'll have to again use it. So after 6 hours, you have to continue. So in a day, they use at least 4 to 5 times in a day to control their withdrawals. Not to enjoy, by the way, to control their withdrawals. Right? They are mitigating themselves now instead of enjoying. So what do? They buy drugs, they use the drug, they recover from the effect, and then they'll start having withdrawals and cravings, and then the cycle will go on. This is a vicious cycle. What OST does? If we introduce OST, the buprenorphine, what it does is that here, this point is the point of intoxication, and above it, it will be an overdose. What OST does is that, and this is the craving, right here. When we introduce OST, it blocks all that. And the wonderful thing about OST is that it lasts in your body for 24 hours. And there's a special property which we'll be discussing later. Okay, why OST, why buprenorphine? But you can see that this red line doesn't go up to that intoxication level, neither does it come down to the opiate craving. And it stays in your body for at least 36 hours at the right dose. 24 to 36 hours. So you have to take it only once in a day, and then all the wonderful symptoms of opiate withdrawal will go away. Now this person can perform his normal activities. See, illicit opiate drugs still cause intoxication, craving, and withdrawal. Buprenorphine, what it will do is that there is no intoxication and there are no withdrawals if taken at the stipulated time, at the right dose. And the key word is the right dose. Again, not just any amount of buprenorphine. Let me make that very clear today. So, this particular person who buys drugs, he will use the drugs, he will recover from the effects, he will experience withdrawal. But then if we introduce OST here, if we introduce buprenorphine here, then it will manage the withdrawal, it will manage the craving, so he's not going to buy the drug again. This is the philosophy of OST, buprenorphine. So there are some common myths. I am sure there are lots of myths, and if you have any questions, any myths, you ask me, I'll try my best to demystify it. Okay, one of the common myths is that OST is just replacing one addiction with another addiction. Let's think about it. OST patients continue to abuse drugs. Let's see. OST is only for people with severe addiction. Maybe, let's see. Then opiate substitution therapy leads to long-term dependence. And then there's another one, opiate substitution therapy is ineffective and it is unsafe. Okay, let's see. Number one, OST is just replacing one addiction with another. Is it so? Here, OST helps in reducing the harms rather than perpetuating addiction. Remember we talked about the 7 harms that we have spoken earlier. That is all because of his constant need for use of that particular drug. Every 6 hours he needs to use. Opioid substitution therapy we give for free. Right now money is not an issue. Alright, then he experiences no craving, no withdrawal throughout the day. So, it is reducing harm now. Like Sir had mentioned earlier, instead of committing the crimes outside, they are now focused, or at least they are not wandering away. Okay, and then this one will be again talking more on it regarding this perpetuating addiction in the coming slides. OST is like any other long-term treatments. For example, any of us are diabetic here? So, we know as a diabetic, you need to continue taking your medications. And you know one thing about diabetes? Diabetes also needs a lot of counseling. And this is one area that we don't cover, we don't have enough manpower to cover. But counseling, if a person is educated about diabetes, right, then he or she can adhere to that medication very well. Just like OST. OST also needs a lot of counseling. It's just not medication. People with blood pressure, high blood pressure, hypertension, they need to continue taking their medication, is it not? Or else you'll experience a stroke. Same thing with OST. Another one, OST, it stabilizes our patients. It allows them to engage in therapy. See, the word is therapy here. And improve their quality of life. And here now in OST, what we do is that we don't force them like you need to improve your life, okay? We empower them. We help them understand that they need to change with self-support. That is why in OST we tell clients to come every day to our center to take the particular medication, and we don't give it to their wives or the children or the parents. Why? Because they are supporting self-efficacy when they come to our centers. This is one thing that people don't talk about. Number 2, patients continue to abuse drugs. I have some few data here. Patients on OST often stop or significantly reduce illicit drug use. Some data are not available from our state because it is, let's say, compared to other countries, it is at its infancy. 15, 18 years, it seems like a long time, but not long enough to do a retrospective study. So from data available from other countries here, United Kingdom, they reported 40% reduction in use of illicit drugs within the first few months of their treatment, and it was conducted by National Treatment Outcome Research Study. In the United States, the National Institute of Drug Abuse reports that 80% reduction in illicit opiate use who adhere to the program. Then there's another study from Australia that says 70% of reduction after 12 months of treatment. Then in France, in a nationwide study, 85% of patients on buprenorphine reported abstaining from illegal opiates after 12 months of treatment. These data are not available in our country because our country, due to its population, and number 2, due to its we lack an infrastructure for such data. But I think our SACs also can now produce data in the very near future. Another one is that the OST substitution therapy helps patients regain control of their lives by reducing craving and by withdrawal. Why are a lot of people getting into drugs? That is because they don't even know they're getting into drugs, number 1. Number 2 is that the false narratives given by the drug peddlers. If they talk about how bad is sunflower, I don't think nobody will be buying from them, is it not? So they'll be telling wonderful stories. I'll tell you a wonderful story. So I was called by this senior doctor. Something come up right here. So I was like, okay. It was in the new semi-cabin, so I went there. Look at this individual. This guy, he came for bleeding through the rectum because of hemorrhoids. But he's behaving a bit unnaturally. So I was like, I looked at him and I was like, yeah. A person suffering from hemorrhoids is undergoing opiate withdrawal. So what is it? Apparently, his friend who was a drug peddler told him that if you put a little bit of sunflower up your rectum at the place of hemorrhoid, your hemorrhoids will go away. So he has been putting it for years that he got addicted to it, not even by chasing or not even by injecting, but through the exit, let's say. Okay, so sunflower has been entering him through the exit. So see, and he was misinformed. So I think, I feel like the churches, the school education system, I think we have to, again, disseminate more information regarding this drug. Our children know, because sunflower, you know how is it taken? I'll give you a brief introduction how to use sunflower, and then later on you can come for masterclass. I can give you a degree as well. So, see, just imagine this is an aluminum foil, okay, a small aluminum foil. They put the sunflower here. They cover themselves with a bedsheet, by the way, and then they burn the sunflower. So the smoke that is emitted from it, they inhale. Now, how hard is it? How easy is it for me to inhale a smoke? No. When someone is cooking in the kitchen, even me, I just go and then get the smell first, then I decide whether I should be joining them for dinner. Right? So it's so easy for us to just, and then they're getting into it. Like Sir has mentioned, they bypass all the gateway drugs now. We're talking about tobacco and alcohol and other things, but then they're getting right into opiate drugs these days because of the route of intake, and then the media, the education system, we are talking about big syringes and big tablets, and it's coming in another powder form. And once we talk about this powder form, no, these people are so smart that it will come in the form of a cream or a lipstick, and we don't even know. Just like in COVID times, all the routes were blocked. I remember searching tobacco for my friend because the 10 rupee tobacco had gone up to 150 rupees. Right? It was not available at that time, but sunflower was readily available because these people did not come through proper channels. Not then, not now. You'll always find an ingenious way to get back into business. So that's something that we should be aware of, and I deeply feel in that manner. See, has any one of us tried to lose weight here? Raise your hands, because I'm doing that every day. And you know, the bad part is, our sex, these last few weeks, I've been participating in a lot of their programs, and they're overfeeding me. So I have to blame them. But see, I think if there was a guide for me to lose weight, no, I think I would have lost weight since 4 or 5 years ago. But there's no guide. I'm just getting my own information, looking at YouTube, looking at Instagram, and then still not happening because there's no guidance for me. I think most of us also have battled through tobacco addiction as well. I think you would have given up on tobacco if there was a guidance counselor, someone to guide you through that. Okay, same thing, addiction. The psychosocial support is very important. And here you think that we're just counseling, but no. What we do is that we do motivational counseling. First, we find out what motivates them to change. Or if you don't have any motivation to change, then we introduce that motivation. And then we help them change their behavior. Their behavior therapy is a big part of our substitution therapy. And then once they come out of the program, we help them prevent from relapsing. But so sadly, the major work is done by our counselors and our people, the unsung heroes. They are doing all the groundwork, the dirty work, let's say. They get into fights, because of the nature of the disease. You know, but that is not spoken about. We are just talking about the magic bullet. And by the way, let's be very clear that OST doesn't give you the kick, okay? No matter what, that's a ceiling effect. That's one big misconception about us, that, you know, OST to Kohima to highway. It's not. Let's be clear regarding that. See, the truth about OST is that it reduces overdose deaths. Okay, Australia and Scotland have found that 60 to 70% reduction in overdose deaths. Okay, from people receiving OST. Reduction in crime rates, 32% decrease in criminal activities related to drug use in UK. In Sweden, 70%. Improvement in health, especially when it comes to hepatitis, HIV. 54% reduction in HIV infection among people who use drugs. And this report is by the United Nations Office of Drug and Crime, and it stabilizes life. France has reportedly helped 75% of their patients stabilize their lives. So I think if we do a research, if we do a proper data, even Nagaland won't be far behind, because the impact is just that we don't have the hard copy, because the program, let's say, it's in its adolescence, not infancy, but in its adolescence, it doesn't mature properly. That's why. These are some of the facts and figures. Everything that I spoke to you about is all fact. There's no nothing that I came up on my own. Okay, it is from proper clinical documentation, research data. So let's go through a simple question and answers. OST is replacing just one addiction with another. Is it true or false? False. OST leads to long-term dependence and patients can never stop using the medication. Is it true or false? Because we have treatment goals. Okay, we need to attend them first. Number two, OST medication like buprenorphine are approved and endorsed by Global Health Organization. True or false?
True.
Patients on OST can only benefit from medication. Is it true or false? It's not just medication. Yes, counseling and referral systems. Right. That is the biggest part for me, I feel, not the medication. Just like my weight loss journey. Another one is, which of the following is a common misconception about OST? This is for this. Because yeah, it's objective question. So OST helps in reducing illegal drug use. OST patients are still addicted and cannot lead normal lives. OST helps reduce the risk of overdose death. And OST can prevent HIV transmission. Which one is false? B, no? Yes. Yeah, so a big clap to them.
If I'm engaged in if me and my friend, we are engaged in a drug peddling activity, my friend is a consumer, user, and I am the one who is dealing. And in the process of investigation, the friend gets apprehended by the police or by the local youth or by any other members here in Nagaland. And if he complies with the investigating agency saying that he'll help in disclosing how he got the drug and who is the supplier, how he got the deals being made, and then I come into the picture and then I get apprehended because of his confession in that sense, or his statements given to the police, then my friend will be given the immunity, and he will be given immunity from prosecution. This is what Section 64 says, power to tender immunity. And I think this is also done so that what we see mostly is, what we see in our society mostly is drug users community. They are being considered as, it's a ruckus to the society, social health, emotional, job perspective, everything comes at a turmoil, you get it? So I think that's how the act comes to kind of curb to curb the social instability that happens. And the next one would be on section continuation. A tender of immunity made to and accepted by the person concerned shall, to the extent to which the immunity extends, render him immune from prosecution from any offences in respect of which the tender was made, if it appears to the state agency that any person to whom immunity has been tendered under this section has not complied with the conditions on which the tender was made, or is willfully concealing anything, or is giving false evidence, the state as the case may be, record a finding to that effect, and thereupon the immunity shall be deemed to be withdrawn, and such person may be tried for the offence in respect of which the tender of immunity was made, and for any other offences for which it appears to have been guilty in connection with the same matter. So if, in case I agree to testify and then I do not comply with the investigating agency, I give false information, I give false evidence, I do not lead them into the agenda and goal of the investigating agency, then the immunity with which I was granted, it will be forfeited by the state government or by the investigating agency, and then I will be tried as per the provision that has been laid down under section 27 that we have discussed about. It could be for consumption or it could be for illicit trafficking, will come under again different section, but immunity whichever has been granted, if I fail to comply with it, then I will be I will be prosecuted under the relevant laws. So that is what section 64 talks about. Now to go to section 64A, that will be immunity from prosecution to addicts volunteering for treatment. I think this particular section is very important for us all present here today, because it's not just in the medical field that gives it's not just in the medical field, but also the legal provision that gives an umbrella of safeguarding for immunity to drug users community when they volunteer for treatment. So it clearly states that any addict who is charged with an offense punishable under section 27 or with offenses involving small quantity of narcotic drugs or psychotropic substances who voluntarily seeks to undergo medical treatment for de-addiction from a hospital or an institution maintained or recognized by the government or a local authority and undergoes such treatment shall not, it uses the word shall, so in legal terms shall is obligatory and a binding factor. It's not a maybe, it's not a confusion, or it's not an unsure thing. So it uses the word shall, so it's in assurance of such treatment shall not be liable to prosecution under section 27 or under any other section for offenses involving small quantity of narcotic drugs or psychotropic substances. So see, if we are being apprehended, and the section is very clear in plain reading, it clearly says that if I volunteer to go for treatment in de-addiction, in any of the de-addiction centers, then I will not be prosecuted as per the provisions of law. This is very clear in section 64A. So coming back to this, I don't know, it's just a thought that has occurred to me while deliberating on this particular section. There was this one time when I was talking to one of the accused. He was also he's an addict and is currently in judicial custody as well. That is in jail, and there are times when they are being brought to court and to have the overall inspection, and that's the time when we get to interact with the accused person or with the clients. And this particular instance, I asked him, okay, are you also do you consume drugs? He said yes. Okay. But that's what he told me at that point of time. So I think today, I mean, OST is a word that I've heard because of my affiliations with the Nagadao and NAN and ARC Foundation, etc. But I never really understood the importance that it played until the previous session. So when this person said he's also under OST, I think now I get to realize that he's undergoing through a process of reforming himself. But I'm also a little apprehensive on whether and how the medications are reaching the jail in time or not for user communities who are lodged in the judicial custody, So I think that's also very one aspect that maybe we can ponder on. There are drug users community inside the prison as well. And their treatment protocols, how is it being followed, whether the medicines are reaching on time. I think that was a point of concern that pricked me in this particular sitting of workshop that we're having today. So that's what I would want to deliver on this particular section. So my topic is like very, since it's with the user community, it's just been very short and concise, and I'm just delving on just 1-2 section which should be relevant, because if you go under this entire act, there are a lot of legal jargons and nuances. It might be super technical and it will be boring, But not just for the users community, but I also want to highlight very briefly on illicit trafficking of drugs from one state, interstate, to another state, from countries to countries, and that the provisions are very stringent when it comes to NDPS Act. So when we deal with cases of NDPS as well, we also know the issue. I mean, we understand the reason why they get into such kind of trading business as well of selling drugs. Maybe they do not have money to look after the families. For some, it becomes the source of income in looking after their family. But having said that, the act in itself, when we try to get even a bail, forget about getting acquittal from a trial, that is altogether a long process of legal battle that will go on. But just to get out the accused out from the jail itself, when it involves NDPS, it's very strict, and courts have become very stringent as well on granting bail in NDPS, because some of them, since it's become the source of livelihood and it's very fast money, because their demands are very high even in our society, they earn in terms of, God knows, in like 6-7 digits figures as well, you know, when they're dealing with such kind of business. But to get bail becomes difficult, but once they're granted bail, what we see is, since it is their form of livelihood and it's very fast money, they go back to the same trade again, all the suppliers and the peddlers and the dealers, etc. So I think in such an instant, it becomes for everyone collectively to, you know, the investigating agency, the medical wing, the legal wing, the society, the church, to understand, you know, the implications and how we can combat this, if at all. Because bail is another thing, but for small quantity, the punishment is lighter. For medium quantity, the punishment is a little higher, and for commercial quantity, which we call it in legal terms, it could be, I mean, we keep seeing in newspaper as well, you know, commercial quantity of so-and-so being seized. So for those, like, even minimum imprisonment goes up to about 20 years, and with 2 lakhs of fine. So once we get caught in the web of the investigating agency, then 20 years, given that we are going to be in prison if we do not get acquitted in the case. So that is one thing, and yeah, I think that's just on the section that I wanted to deal with, because it's a very too specific section, but also further to just give some thoughts and opinions on when we talk about substance abuse and the law. Because substance abuse, when you think about it, we are dealing with drug users community, and then in terms, then also we are dealing with HIV positive persons, then also we are dealing with a lot of STI patients as well in that process. So what does the law say when it comes to all this? So just to put a thought and a highlight on what it is about. So earlier on earlier occasions also, when Ketua and us, we have all worked together, we have touched up a lot on HIV/AIDS issue cases as well, and we see that they're also from drug user community. And one thing that the one thing that we always hear is what they face when people or when the society come to know that they have HIV or they are from a drug user community. They face one thing is they face stigmatization, and another is discrimination and social outcast. It could be from society, it could be from institution, it could be from churches, it could be from schools, it could be from their workplace, you know, or it could be even from your own family, because their perceptions were so fed up of dealing with him, you know, or dealing with her. So this kind of social implications they undergo through. So and then what the law says when it revolves around drug users community. I think number one thing to delve is on what the Constitution of India says when it comes to right to life under 21. So right to life of good health, everybody needs to have a health being, right to health of being treated properly, right from discrimination. So I think it's not just, I think it's very important for us to understand that we are all governed by the Constitution, and the law is also very stringent when it comes to protecting the rights of the positive community and also for the drug users community. I'm not going to go into all the Supreme Court landmark judgments on how, you know, it has given directions, but just to give a bullet point on what the law says about on how we should be treating when we encounter such people from the users community or from the drug community. That's one thing. And I think another thing, I think one of our speakers have also earlier mentioned that how powerful our colony and youths have become today. You know, they apprehend an accused person, but then they get massaged, as what our previous resource person has spoken. I think one thing we should also be very careful is not to take law into our own hands, okay? Otherwise, I mean, poor fellow, he got apprehended by the youths, he got massaged, you know, he got a spa, sauna, whatever kind of treatment he's gone through. But he can also lodge an FIR against you for abusing, for assault, okay? Those are all, again, two different factors. So I think we need to be very careful while dealing with I wouldn't say like culprit, but when we're apprehending such kind of a situation, you know, what we as youth must do, what we as church must do, what we as an individual must do when we apprehend such person without having to resort to violence or without having resort to shaming the person. Like, I think we should let the law come into the picture and let the law deal with things rather than taking law into our own hands. Because 2-3 occasions I've also come across where the poor fellow, he's just like 21 years old. He got caught stealing, and then he was being trashed very badly by, I'm not going to name anything in specific, but this has happened, and I think it's not right also to be taking legal measures into our own hand, because we have the penal code, we have the NDPS Act to look into things, you know, if at all we want to go for the correct procedures and the measures. Otherwise, it could backfire on us as well because of taking law into our own hands.